Good afternoon, Victoria County. As of today, we do have 2 new cases of COVID-19, bringing our case count to 148, but we do have quite a bit of new recoveries that David will speak on in just a moment. So today will be our last regularly scheduled press briefing. We will continue the daily updates on social media and the website, and if the need arises, we will be willing and fully able to reactivate these regularly scheduled briefings. In the beginning, as you all remember, everything about this was rapidly changing and new. And largely over the past few weeks, our message has remained the same. As we continue and begin to reopen, we urge the public to continue the use of staying at home if you're sick, practicing social distancing, frequently washing your hands, disinfecting commonly touched surfaces, and wearing a facial covering while in public. Today we have 2 sets of speakers coming in, the first today being Rick McBrayer, who's going to discuss emergency operations in Victoria County, and David Gonzales, who's going to give an update on COVID-19 and the Public Health Department's ongoing response to that. Following that, Judge Zeller and Mayor McCoy will come in and give some remarks to our community. I'll now turn it over to David.
Thank you, Caitlin. Kind of going to get a brief, rundown of where we're at in the current situation, and kind of looking ahead, being this is the last press conference, scheduled press conference, I should say, at this point. So like Caitlin said, we have 2 new cases today. The great number that we want to look at is a recovered number. We're up to 117 recoveries, which is great, which is sitting right about 80% of the total cases recovered. So that is good news. We still do have 26 active cases, so you can tell from that the virus obviously is not removed from the community. It's still out there. It's still a threat, so we want to treat it as such. However, we need to understand that we are moving in a positive direction, and we hope that continues the current track. And we still do, unfortunately, have 10 hospitalized, 3 of those being in the ICU. So they're definitely a focus, and we hope they can quickly recover. The outbreak situation, it looks like they're holding steady. We're not going to rule out the possible further spread of that. At this point, what we like to do from an epidemiological perspective is wait 14 days after last illness onset to make sure we clear that, and then that's when we can officially deem the outbreak as completed and over with. I think we're still looking at about 6 days left on that one, so we're still keeping a close eye on that. We're not taking it lightly. We would definitely want to make sure that it is well contained, that we don't have any further effects of that. So, and Pam has done a great job. The epi team have done a great job on containing that up to this point. Again, just a reminder that the virus is still out there. I know we're trying to return as a community, as an economy, as a society, back to normal in a sense. And that term normal is not a normal as what it was 3 months ago. So looking ahead, just keep in mind that we're trying to get back into a routine, back to work. But the virus is still prevalent. It is still out there. We see that across the country. We see that across the state with new cases every day, cases in the tens of thousands across the U.S. I think the new case count today was at 24,000 across the U.S. Texas, I think we're right about 1,000. Actually 968 today across the state. So as you can see, it's still out there. Locally, luckily, there's only 2. So that is good news, but just keep in mind going out there, still, you don't want to relax those social distancing measures, those personal protective measures that you've been doing up until this point. And even more so, you should be more vigilant in that because of the community. There's more members of the community out there. There's going to be more possible exposures out there. But again, that's not meant to frighten or to scare, but just be aware. That is the key. Be aware that it's out there, and just take precautions against that to prevent further spread of this. And for us, we're really looking at preventing any kind of resurgence as well. Looking ahead, our epidemiological team, just because this is our last press conference, just because we're shifting our schedules with operations here at the UOC that Rick will touch on a little bit. We're modifying that. Doesn't mean anything's changing on the public health response or epidemiological response to the situation. The team is still going to be investigating, still doing the contact tracing. Nothing's really changing on that end. So the public health response piece is still going to go on day to day just like it has been. It may look a little different in the public eye, but that doesn't mean that work is still not being done. We'll still be continuing investigations, still continue contact tracing, as a public health department, we will be looking ahead as far as opening up other services that we have, I guess, closed down and scaled back on due to the response. And as we open those up, we're going to need staff from that epi team to pull those over back in those two departments to, respond and treat other public health symptoms and support the community in that sense. And part of that plan is going to be relying on the state government to provide some of those contact tracers and some of those mechanisms to continue this and support our locals in support of this response down the line. Next, I want to touch a little bit on testing, and it's something we've been speaking about since day one as far as testing supplies and capabilities. We continue to see ample testing supplies here locally, both with our urgent care clinics, with doctors, hospitals. The latest estimate that I have, and keep in mind this is a rough estimate because we haven't been able to get the true hospital numbers. They're doing a great job. They're testing a lot of their incoming patients. So we don't have those numbers yet. That's something we're going to work on to get adequate numbers or accurate numbers from them. Right now we're looking, apart from the hospitals, we're sitting about 1,600. So I think we're approaching, off the top of my head, 1.6, 1.7% of the population just with those local labs and the few rapid tests that may be out there. But I think honestly right now we're sitting more closer to 2%, which is the governor's goal from what I've read. That he's looking at about having the state population tested at a 2% rate. And in all estimations, I think if Victoria's not already there, then we're getting very close to that. So that's encouraging. If there's ever a need, if we ever run out or run low on testing capability, one thing that's been offered up to us is state resources. And you've seen it in the communities around us. You've seen the Texas Division of Emergency Management and their folks and the teams they've compiled to do testing across adjoining counties. That's been a resource offered to us as well. We don't have found the need for it yet, but if the need arises, we'll gladly take those on. What we really want to do is supply those surrounding counties that may not have quite the capability with those testing, assets, if you will, for them to support their citizens there. Finally, PPE, personal protective equipment, we're seeing more and more coming on daily. Again, we've relied on a lot of state and federal resources for that early on. We've had some generous donations from Pam, as you'll remember, of masks, 30,000 back a few weeks ago. So that's definitely assisted the community. We're now seeing our normal supply chain slowly come back on board just within the health department ordering, and the hospitals and doctors hopefully have seen that a little bit as well. I know our logistics team has supported, and our Golden Crescent Medical Operations Center supported several entities with continued PPE requests. So we'll continue those if the need is there. They're working their best to fill those. And hopefully in the next few weeks and coming months, then that normal supply chain will be up and running, and everybody will be able to get what they need there. Just one last thing, I want to throw a few stats. I'd met with the EPI team before this and got a few stats. I don't want to throw too many numbers out, but just looking back at where we're at right now, it gives a good idea about going into this weekend, going into Mother's Day, and I know there'll be plenty of family gatherings out there. What we're seeing is about 26% of cases we've noticed have been through household contacts or close family and friends. So that's kind of the group you'll be with this weekend. So keep in mind about a quarter of the cases that we have out there have been contracted that way. So again, if you're meeting with family, great. Just take precautions. If you're sick, probably don't want to be around family to spread anything that you may have. And then just keep in mind, you can still socially distance a little bit when you're in those settings. A little further in those numbers, the couple of outbreaks we had were sitting about 36% of the total cases. Healthcare worker exposure was about 9%. Travel related was about 5%. And then just community transmission, where we couldn't identify the transmission method or the person-to-person contact, was sitting about 24%. So those are just real rough numbers I wanted to give you today. But with that, I'm going to hand it over to Rick.
Great, thank you, David. Good afternoon, everyone. Rick McBrayer, coordinator for the City of Victoria and also Victoria County. As Caitlin had mentioned earlier, we are winding down the press briefing piece of our public information section of our Emergency Operations Center here related to the response of COVID-19. What many people may not know about the Emergency Operations Center is that it is a fully scalable, warm-ready operations center that can be activated for any situation our community might face in these trying times, either now or even later on. We fully activated our response to COVID-19 over 8 weeks ago. Understanding that we'd be a communications-heavy event associated to it with the COVID-19 pandemic that was so new to our community and new to the region and also the state. At a moment's notice, we stand fully prepared to reopen or relaunch the Emergency Operations Center if we need to, if the situation deems necessary. And so it's important for everybody to understand that we're here, we operate around the clock, myself and the staff here in the Emergency Operations Center. The initial response may look different from any other events such as hurricanes and flooding that we're used to. These decisions are made in large part with collaboration and coordination with our local leaders, local elected officials, and our first responder community and our command staff. We do that in essence of everything we do. We keep in mind keeping Victoria community and the Victoria residents safe. Here in the Emergency Operations Center, we train for a multitude of things. We train for pandemics, all the way down to chemical spills, to flash flooding, severe weather, and to hurricanes. I think many of you probably recognize that and see many of the classes and courses we put on, so it's important for our community to understand that the Emergency Operations Center trains for a variety of things. Through our training that is in line with our national standards of first responders throughout the communities, what we call a National Incident Management System and ICS, which is Incident Command System, we're scalable and we're adaptable to many things that come our way. And so we want to make sure that everybody understands that we collaboratively work together as a city and a county with sometimes some very tough decisions that have to be made amongst those leaders. So I want to make sure that everybody understands that while we are pulling down the Emergency Operations Center to a higher readiness level and shifting some of the responsibility back over to the health department, we want to make sure that the public understands that we're still here ready to go. Speaking of different events, obviously we're approaching the hurricane season. Obviously we know hurricane season is coming up June 1, and so obviously a lot of times the Emergency Operations Center, people look at emergency management and the staff that we have here thinking that we're the weather folks, and so we're oftentimes misconstrued as that, whereas we're not. We're just subject matter experts in a variety of fields. We're making sure that we put the collaborative efforts and cooperation and coordination to the people that can do the jobs. And so, but we want to talk a little bit about hurricane season. And what does it mean as we approach June 1? And we want to make sure that people understand that they need to know their risk. We understand that we live in a tropical region here in South Texas. We're close to the coast, so obviously we have an instance of tropical systems and storms and hurricanes that can come on in a very short manner and time frame, and we need to be ready to respond to that. So understanding that. Some of the risks that we also know that we need to be associated with is that, do you live in a surge zone or close to a surge zone? And that's important, especially to our communities to our south. Is your property, your home, properly secured and protected? Do you have have your home or your residence been built to the latest construction codes and things like that? So those are some important key factors of knowing your risk and knowing some things associated to those things. Staying informed is the next big piece for us. Staying informed is so vitally important for our community members. And how do you stay informed? Well, you stay informed by the first and foremost thing is have a NOAA weather radio ready to go, battery operated. Stay in tune with your local media sources. Stay in tune with your National Weather Service out of Corpus Christi is who we use, and also the National Hurricane Center. Stay connected to the social media websites, social media sites and websites as well. Some other things we try to have people do is do an insurance checkup. Do you have the proper insurance to protect not only your home, your belongings, flood insurance, car insurance, even down to the piece of medical insurance and renter's insurance. Oftentimes we forget about those things. The next big step is have a plan. The success to your response to anything is how well you've planned for it, and how resilient you become to that is how well you planned. And so it's vitally important for us to make sure that people understand that. Make sure you have a plan. Within that plan, make sure that you understand that if I have to evacuate, where are my evacuation routes? Where am I going to? Do I have a plan on where I'm going to, and how am I going to support myself when I get there? Do I have enough cash on hand? Do I have the medical supplies I need and things like that? If you have to shelter in place, the shelter in place is a very unique thing for us. We saw that with Hurricane Harvey. The rapid intensification of Hurricane Harvey made evacuation a very difficult process, and so we had to move over to a shelter-in-place campaign. And that then places us in our homes, and do we have ready supplies and ready to go, which leads me to the last point. Build a disaster supply kit, making sure you understand that you have 3 to 5 days of non-perishable food items and water for each and every person within the household or member that you're going to be taking care of. Do you have enough medications on hand to last you for several days? Because remember, our supply chains oftentimes will come offline for a short period of time until they can come back online. Do you have enough pet supplies? Can you take care of the vulnerable population within your own home and within your neighbors around you, which means the elderly people or people that may have some unmet needs that they have to have met. And make sure that we just have some basic supplies on hand. Manual can opener. We understand that sometimes our utilities will be disrupted for a couple days, and so we've seen that in the past. But build a checklist associated to the things I've talked about, making sure that we're ready to go and we can react to those things, because once again, your success depends on how well you've been prepared. And so also know when to return. Obviously, we know that we're going to have damages done to our utilities and to our local community, and make sure that you stay in tune with the local press briefings we'll have here. Make sure you stay in tune with the local officials. So if you do evacuate, what's the best methodology and when you should come back, and so we can communicate that information out to you. A couple of websites you can go to get some great information on preparedness tips associated specifically to hurricanes is the National Hurricane Center. It's at nhc.noaa.gov. And or you can also go to ready.gov, which is another great site to go to with some preparedness tips associated to hurricane and hurricane preparedness. So with that, I'll turn it back over to Caitlin, and then we'll go from there.
Thank you very much, Rick, for keeping us updated with hurricane season coming up and some preparedness tips we can take now. Another way that our community, and specifically those of you at home who are able to donate blood, to help keep our community prepared for any event, the South Texas Blood and Tissue Center still has an everyday need for life-saving donors to make appointments and donate blood. And so you can actually they're still accepting donations at the moment, but by appointment only. So if you are willing and able to donate blood, we encourage you to call the South Texas Blood and Tissue Center at 210-731-5590. And we'll now open it up for any questions.
David, one of the questions that I'm sure that you're getting from the community, so I thought I'd give you an opportunity to maybe, answer that now is, we've just heard in the news in the last couple of days that Texas has had the highest number of positive test results for COVID, versus we are going to shut down the, emergency management operations meetings. Absolutely understand that from a perspective that each community is different, but give us some of the reasons why you guys have decided that this is a good opportunity, a good time now to stop the meetings with the option of reopening them at any time.
Sure, and I'll tackle part of it, and I think we'll all bounce back and forth on it. I was going a little bit, I was kind of prepared for a similar question. I went back and looked at this past week's numbers, new case numbers, both nationally and across the state. And across the state, we've been pretty steady and really not that big of an increase from previous weeks across the state. Keep in mind one thing, there's been a major push by the governor in the state of Texas, and along with the Department of Emergency Management, to really push those testing numbers, and they're really wanting to increase those. And like we've been saying all along, and Dr. McNeil has said all along as well, is the more testing we're going to do, the more positives we're going to find, essentially. And with the hospitals now opening back up, bringing on elective surgeries and the testing they're having there, we're going to identify more positives that some may have been asymptomatic, which is great, which is good. Now we can isolate those folks as well to keep them from being out in the community. So I don't really see it as a terrible thing based on the new activities and new actions that we've been taking across the state to identify those. As far as the emergency operations and I guess the EOC operations here scaling down, really the response piece is not changing. The only pieces really going to be changing are the ways we're getting information out, and that we're going to shift from live press conferences to the same methods of daily briefings through social media and through the website. We're always available. The hotline's still going to be active. So on the response piece, there's really no change at all. It may look different to the public, but it's a great question. I anticipated that as well. The look may be different, but behind the scenes, nothing's really changing. I mean, the response is still there.
And to add on what David had mentioned earlier, many people don't understand that back in middle part of February, we started this process, and just like any other event, whether it's a hurricane or flooding that may be occurring on the Guadalupe River, we ramp up operations, and we have what we call situational awareness reports that go out. And from our office here in emergency management, we start pushing that out to our command staff and our policymakers to start bringing them up to speed on what's happening, and that way they can start making some relevant decisions. The subject matter experts can then be included and help them make those decisions and give them the relevant information. So we started that back in February and started having state conference calls. We started having local conference calls and started engaging ourselves with our command staff. Even before you saw us ramping up full-blown press briefings. And so we're just kind of swinging the other direction now as we start to pull down on that response a little bit, whereas the response is going to still stay the same. We're just pulling back on the press conferences that are going to be occurring every single day, or, well, now we're down to 2 days a week. And so that's just going to shift a little bit. But we'll still be exchanging the same type of information with our command staff and our policymakers and allowing them to still make those relevant decisions they have to make.
And on a communications end to it, largely in the beginning, like I said, if you remember back to March when we first launched this, information was changing on a daily basis because nobody had ever heard of it. And in a large way in our community, in our personal homes, and our preparedness, pandemic wasn't really high on our list. We weren't really prepared for it in a personal sense. And so that was a large amount that we had to ramp up and inform our community, because a lot of the response looked like what we might respond in case of a hurricane. And a pandemic looks so different. And so for us, we really made it a priority to get those things out there. We printed flyers to put up in businesses. We had our law enforcement make educational contacts without the community. And that's why we saw such a huge ramping up in the beginning. But for the last month, that message has stayed the same. Practice good hygiene. Wear a facial covering if you can. Avoid any unnecessary trips. Stay home when you're sick. That's kind of the same messaging that our community is just going to have to take up that responsibility like they have been, and continue that going forward as we open up.
It's amazing to think, like 8 weeks ago, there were days when most of us hadn't slept for a day or two, so we were trying to put it all together, as opposed to where we are now.
Yes.
You all did mention that if there's a need, you would start up these press briefings again. What might that need, or what would happen that would lead you to do so?
Absolutely, good question. So we've spoke about this morning, just the very issue as far as what are going to be those factors, looking at them. A rapid increase locally of new cases, a major change in advisement from the CDC or DSHS if there's some major observances they see with the disease itself. If, heaven forbid, if there was a big change in the symptoms or anything like that would make us more aware of those possible positive patients. Things like that. A healthcare system overload due to something else that may affect response. Those are some of the factors. I don't know if there's anything else you want to add.
Or any of the major decision points that our elected officials would have to place into effect, any type of order or anything like that. And obviously then we would have our legal staff, elected officials, re-engage in that activity. And so that would give us an opportunity as well.
Rick, in the
Yes, ma'am.
history of the EOM, have you ever so heavily opened the doors to media? And is there any event that has ever occurred since you've been here where the EOM was doing daily press conferences for this long, this amount of time?
Not for 8 weeks, no. And so this has been the first. And so most of the time we have an event that occurs and we see the sunny day aspect to it later on, whether it be flash flooding, whether it be severe weather, whether it be a hurricane or tornadic activity. We kind of see downrange where there might be an endpoint where we can all walk outside, see the sunny day and take a deep breath. This has been very unique. It's been fluid. It's been changing. And so to answer your question directly, no, I've never seen it where we've had the Operations Center open up and running for 8 weeks straight like this. And so.
Right, and now you've actually been through a pandemic, so
Sure.
you can
Yeah.
Check that off the list.
fully prepare.
And pandemics are very unique. David, in his former capacity of being the Public Health Emergency Preparedness Coordinator and even being here with our office in emergency management, pandemics are things that we have plans for. There's definitely things that we exercise towards and have drills, but then actually put it into real life scenario and walk through that has been unique. And so.
Well, we thank you all so much for the time
Thank
that
you.
you've given us.
Thank you.
Do you anticipate any growth in cases with businesses starting to reopen more and more this month, starting tomorrow?
Yeah, it's one thing we're watching real close, and I'm glad you asked. It's, with the initial, I'm trying to think back a few weeks, change in orders and the slow opening of businesses and the activities, the public activities that folks are involved in, we've been watching and anticipating week to week because like we've said before, it's usually a 10 to 14 delay response of new cases based on the actions that we're taking. So week to 2 weeks, we're looking back. The actions a week and 2 weeks ago, that's what we're seeing now in those effects. So we're still, holding out. That's me being a little pessimistic is looking to next week, and I'm not really going to be that much more comfortable until we get through next week because of the new openings in the past week or so. So I will look at that. I will be hopeful. Case numbers and counts stay low. But definitely we are very, very aware of what's going on. We're watching it very closely. And I think that's when we're going to get a good read on the response to the virus. And that will coincide with the public's response as well.
I do have one more question, a final question.
From me at least, is what have you seen in this virus as far as changing and the adaptation of the virus itself?
Yeah, and I don't want to get too far into that because I'm not Dr. McNeil, and I would gladly turn this over to him. I don't want to throw it at Rick or Caitlin. But, you know, I know just observations of the signs and symptoms really is the biggest change that we've seen, and they learn more and more about the virus every day. You see studies every day and you hear about them, you know, we're seeing this, you know, in a lab it behaved like this. It's hard to really hammer down and say, yeah, we're going to go with that and run with it. You know, you've seen a lot of, well, it survives 3 days on substance, and then an hour later you hear, well, it survives 10. So it's really hard to, you see so many changes, and it's just so much new information coming out. The signs and symptoms and the, I guess, duration of the illness is the change we've seen. We've seen some of the stats I was talking with Brittany about earlier is the illness duration. On average, we're seeing it about 15 days stick around of symptoms. So that's quite a long length of time that we're seeing with that. You know, and then most recently last week with the CDC issuing guidance on the new advisement for new symptoms. So that was one of the major changes as well. We were seeing that a little bit in cases. We weren't sure if it was just an isolated event with a loss in taste of smell and early on in the disease. So I'm glad the CDC, you know, issued guidance on there. So I hope, you know, any further observances they see on a national level, they're able to pass those down so we can really do what we can to isolate this illness.
Thank you. And I'd just like to thank all the residents at home who are tuning in today. For anybody who may have caught out or missed out in the beginning, we do have 2 new cases today, and that does bring us to a total of 148. But of those, we do have 117 recovered and 26 are currently active. As mentioned before, today will be our last regularly scheduled press briefing. However, if the need arises, we're able to fully reactivate that. But we will continue our daily updates on social media and our website. And our COVID hotline is staying fully operational as well, Monday through Friday, 8 to noon and 1 to 5. And that phone number is 361-580-5796. Again, that's 361-580-5796 for any questions you may have regarding COVID-19. And we're now going to step out and turn it over to Judge Zeller and Mayor McCoy. Thank you.
Good afternoon, ladies and gentlemen, and thanks for tuning in. As mentioned in the previous panel, we'll be scaling our emergency operations back to match the need for it. We feel this is appropriate. While precautions from the community are still warranted, our COVID situation in Victoria is manageable, and the effort of our community is showing results. While new cases can certainly be expected going forward, currently the number of recovered cases to new cases is about 4 to 1. Rick talked about the Emergency Operations Center in detail a minute ago. Emergency management is a vital service that your city and county provide. And being able to do that effectively requires the hard work of a lot of people. And I want to take the opportunity to thank Rick McBrayer and all the members of the Emergency Operations Center, David, Brittany, our epidemiologist, and of course Dr. McNeil, as well as all the folks in our health department, our command staff, law enforcement, the many, many members of city and county personnel who have been assisting and will continue to assist with this effort. It's truly a team effort. A message we've heard loud and clear is that during times of crisis or possible crisis, the community wants to get information and updates directly from the source. These briefings and the updates and daily reports on our website and Facebook page have been the source of accurate and timely information in Victoria. Folks also appreciate knowing that we have an excellent team of emergency management and medical experts who have been working hard throughout this issue. That's a model of communication we plan to keep, and although we'll be having these briefings only on an as-needed basis going forward, we'll continue to provide updates via the Health Department's Facebook page and our website, and we'll still have the hotline available for the public to call in if needed. And certainly we'll be back here anytime we need to be. Transparency and communication are always top priorities for us, and we've been able to deliver on those priorities due to the fantastic work of our PIO folks, and I want to thank them as well. As we all take further steps to get back to normal, there is good news, a lot of good news. Caitlin mentioned the new numbers, how we're about a 4-to-1 ratio of recovered to active. That's fantastic news. Tomorrow, to some extent, businesses will be less burdened by state mandates and restrictions, and then going forward, that burden will be lessened even more. As I turn the mic over to Mayor McCoy, I also want to applaud him for the leadership that he's brought to the city of Victoria. It is absolutely critical for the city and the county to be able to work well together, and that is especially true in times of emergency or disaster. Today, we are as well prepared as ever for whatever emergency we may face down the road, and that's a good position to be in with hurricane season starting next month. So with that, I'll turn things over to Mayor McCoy.
Thank you, Judge, and thank you for your kind words. Good afternoon. While these have been trying times for our community these past few months, there is a silver lining. There is still hope for what's ahead. I know we're a resilient community that is capable of coming together and withstanding any crises. I was reminded today, it just dawned on me before I stepped in here, that today marks 1 year since I took the oath of office as Mayor of Victoria. It's been an honor to serve as your mayor during this unprecedented event. And in many ways, our response to COVID-19 has been unparalleled. Your city and county leadership have come together like never before to ensure the safety of our community. While you may see the judge, Dr. McNeil, and myself up here quite often, there are countless others who have been working diligently behind the scenes. Behind these doors, city and county staff members continue to work together for the good of this community, from manning the phone bank to working the logistics of PPE supply. These individuals have logged countless man hours to serve, and we have been prepared and ready for not just this event, but for any event. It has made me proud to serve as your mayor and to see the city and county's ability to jointly respond to this event. And it will continue to be a priority of ours to make Victoria ready for any event that may come our way. I know the judge and I both look forward to taking the collaboration and relationship built between the city and the county through this event and using them to better our community well into the future. With that, I will now open up for questions.
Ingram.
What would be your personal message right now to the community at large?
My message would be, number one, thank you. Thank you to the many people in our community who embraced personal responsibility, took things seriously, embraced being a good neighbor. So thank you would be the first message. And then secondly, stating the fact that this COVID is not something that's gone, it's something that's still here, so precautions are still warranted. But whether it's after a hurricane like Harvey or in a situation like this, having the community come together, work well together, embrace their roles of citizens and neighbors, it's encouraging for me to see. So above all, it would be thank you.
Yeah. And I guess from my perspective there, again, I'm proud of our community, because I can tell you when this all started, I can remember we were sitting here already prepared, knowing it was coming, waiting for that first case. And then the case came, and then a few more came. People were scared. This community was scared. I don't mind telling you, I was scared a little bit too. It's always scary to deal with something that you don't know a lot about. But I'm proud of the fact that the community together, along with us, learned about this event. We learned more each and every day from the new guidances of the CDC, from our own experts here, our health department experts, and especially Dr. McNeil. And I want to really tip my hat to Dr. McNeil for having just a very calming and very matter-of-fact way of portraying what the threat was and remains to be. But I'm proud that the community has come together, and where I think we're less fearful now, and I think we're in a position to deal with this virus as we move forward, and because we are going to have to deal with it. So my message is I'm proud of our community that took the responsibility upon themselves and actually made our jobs a lot easier.
You both obviously said that we're in a place that we can push back these press briefings unless, but we've been told if there's a need for them to start up again, they will. I'm curious what you both can what would that need look like that you would say it is time to resume, pick up operations?
Well, I think our conversations in policy have been, we're to a point where this is a public health issue. And it's now really in the hands of our very capable public health department and our public health official. They're not going anywhere. They still stay in contact. I know I personally am involved in conference calls with our state senator who reaches out to us, and I think, Judge, y'all have similar ones. So we're still connected. But really, this is a public health deal to deal with. We, as policymakers, much of the way the governor's orders have come down, they're not so reliant upon us to create policy. So, but we will be vigilant in our monitoring of events and seeing what happens. And I can assure you, we are ready to come back before you to reassure you if events such as a tremendous spike or differences in the CDC guidelines or advice come forth that require a policy direction. And so that's the way it seems to me is when we would go.
Sure. Well, the mayor is exactly right in saying that our public health folks aren't going anywhere, and neither are we. Some scenarios that may cause us to resume these would be that concern weeks back, months back of our healthcare system being overrun. That would certainly be an example where we'd be back here. A significant increase, spike in the number of cases, possible outbreaks. Those could be things, but as I mentioned, I think we can expect the number of cases to continue to increase, or there to be new positive cases as testing increases. That we expect that to happen, but by and large, our message has been consistent over the past month. But this is something we'll monitor, and if we need to be back, we certainly will. Neither the mayor and I are far from here on any given day. Yes, ma'am.
My final, again, philosophical question. I had an opportunity to ask Dr. McNeil and David as well, which is, what have you learned?
Well, I would say we've learned a lot. I mean, I look back at Harvey, which was largely a public works recovery. This is a public health recovery. I think we've learned a lot in terms of working together, in terms of being able to consistently communicate and working together as a team, city and county personnel working well together. I've mentioned it's been a big effort to, especially as things were more rapidly developing weeks ago, a month ago, to identify new information, analyze it, interpret it, apply it via local orders, via local recommendations. A lot of that prerogative is now taken away from us by the governor in terms of taking any local steps. But I see this as a significant learning experience, and that's one of the reasons why I can say confidently that we're better prepared now for anything that may be lurking down the road as at any point previously. Prior to this, we looked at emergencies and disasters largely as hurricanes, but whether it's a hurricane or, a resurgence of COVID or anything else out there, having been at this daily for 2 months has been a big learning experience, but also a wonderful opportunity to hone our skills, increase our teamwork. I think it's been, I know I've learned a lot, and I'm sure the mayor would concur with that.
I would echo those sentiments. I think the judge and I, we knew one another fairly well before this, but I think our relationship is solidified even more.
Absolutely.
And I think we both realize the importance of working together in our community. And it's not only at the level, our level. I'm so proud of the way our city manager, our assistant city managers, our city staff, our PIOs all work together, members of the county, our district attorney coming in with our city attorney. It is truly an absolute great teamwork. And I think when I think back, the decisions we made are much better than decisions I could have made by myself. And I think that's important for the community to know, that you have people in there that can come together and work diligently, have spirited but fruitful conversation, and come to decisions that I think truly benefit our community. And that's why I really am hoping to take this new cooperative relationship beyond this event, because I think we can do so much for our community by working together and getting the benefits of all of the truly smart people that have been in that room.
I'm curious, you guys both again sound fairly confident of where we are handling the situation now. Do you think that it's too early to kind of declare the COVID situation here a victory, with many people still not following CDC guidelines?
It's not a victory yet. It's not a victory. We know that there still will be cases to come, and
Yeah.
everybody knows that, but
Yeah.
we think that we're in a position where it's manageable.
Yeah.
And we have to live our lives.
Yeah, I think we can see the results of the community's efforts, see things paying off. It certainly is manageable, like the mayor mentioned, which is a success. That was a concern, a month, 2 months ago, that possible threat of our healthcare systems being overrun, which clearly they're not. So those are successes, but I would be reluctant to call it a victory due to the fact that A, COVID's still out there, and B, really nobody knows what the future holds. So we'll remain vigilant, we'll remain on top of this, new information, new developments, but that's kind of how I would answer that. We've seen successes, but wouldn't call it a victory yet.
This is simply a transition into another mode of dealing with the problem before us.
Anything else? All right. Well, I want to again thank everybody for their time, for those folks listening online. While this is our last regularly scheduled press briefing, we'll continue to make accurate information a priority for the community by updating the Victoria County Public Health Department Facebook page, our website, victoriatxoem.org, making sure that has the most accurate and timely local information. The hotline will still be managed at 580-5796 Monday through Friday. As Caitlin mentioned earlier, for those who would be willing to donate blood, that is a need at the moment. To set that up, you can set up an appointment calling 210-731-5590. We want to thank all of the folks in the media who have been here consistently for the past 2 months helping us get information out. Television, radio, print, online, everybody here. We appreciate that, and the community greatly benefits from that. For anyone with unmet needs, 211 is still the number to call. This is the third time since I've been in office that we've activated the Emergency Operations Center, and while I'd prefer there never be a need to do so, this has been a great time of learning and honing our emergency preparedness, being better prepared for whatever may be down the road. And I want to reiterate the thanks to the community. These have been unprecedented times, but I thank everybody who, again, has embraced their role as a resident of the community, as a citizen, as a good neighbor, taking things seriously and paid attention to what's going on. So I thank them and thank you all, and we will see you soon. Hopefully not under a need to resume these, but we will be available when and if it's needed. And I guess just on a more personal note, I want to say to the community what an honor it is for me to, even in trying times, serve as your county judge. This is a role that I've always taken very seriously, and it's one that is an incredible honor for me and something that I put my all into, serving this community, serving in this role as best I can, and I appreciate Victoria County having given me the opportunity to serve. So thank you all.
Thank you.